In task 6.8, I'll go over the rabies protocol for submitting samples to the laboratory. Only technicians and clinicians that have been immunized against rabies and have a serum titer of greater than 1 to 5 should be handling the patient. For small animals, you should be double gloved, wear a protective mask, and goggles. For large animals, should be double gloved with the outer outer layer being heavy vinyl with gauntlets, and should wear rubber boots, a scrub suit with an apron, and a protective face shield. For pathologists that actually do the decapitation, should wear a Tyvek suit or the surgical gown and apron, and should also have an HEPA filtered helmet and face shield, if especially if there's equine patients. So for the submission, if the primary differential is rabies, you'll want to submit the whole head, or in certain cases with large animals, just the brain. You'll want to decapitate it at the atlanto-occipital junction, and then the head should be double bagged and put in a refrigeratable container with ice packets, not dry ice, and labeled appropriately. The knives and scalpels that were used should be disposed of, and the head should be sent to the appropriate laboratory for fluorescent antibody testing. The carcass should be double bagged with red biohazard bags labeled as suspect rabies and disposed of as a biohazard. If rabies is not the primary differential, then you can submit just you can either submit the whole brain or the whole head, or you can do 2 transverse slices of the brain, one including the medulla and cerebellum, and then the other including the hippocampus. When you submit the specimen for rabies procedure, you should have completed a complete rabies questionnaire, have everything labeled appropriately, and make sure that you disinfect and clean everything used very carefully. If rabies is a primary, then you should actually dispose of the tools that you use. And that concludes how to submit a rabies specimen.